Our presenters today are Tibi Guzman, Executive Director and CEO, Deborah Mondello, Senior Assistant Executive Director, and Eileen Hughes, Director of Nursing. Tibi will be presenting first.
Thank you, Christina. Good morning, everyone. Thank you for joining us at this lovely morning. Today, we're going to give you an overview of our COVID-19 update. It's been a year later. I think we all know that, and we're going to reflect on our continued response, and then we're going to discuss the COVID-19 status and vaccine strategies. We're also going to give you a vaccine overview, what you need to know, who is eligible, where can you get the vaccines. This is the time where we always discuss the budget. So we're going to give you what the highlights of the budget and some of the anticipated cuts in relation to our field. And of course, we want to give you an opportunity to help us really curtail any of these cuts by advocacy work. So we're going to give you a call to action opportunity to help us through this. And then this is a great time to really talk about all this because March is DD Awareness Month. And we want to make sure not only our community, but the nation is aware of the people that we support, their needs, their interests, and their aspirations. So this is an important month for us. So with that, we'd like to go to the next slide, please. You know, as I mentioned earlier, we're going to be reflecting on the highlights of last year. Deb and I will go over a few details. Next slide, please. So looking back in one year, we were the first IDD provider with a COVID-19 case. I think we all kind of remember what happened. We had patient zero, and we had the focus on New Rochelle. And it was quite frightening during that time. There was a time of confusion, little initial information, and many concerns. And you know, at that time, we immediately activated our pandemic preparedness plan and formed an emergency management team to secure the personal protective equipment. As soon as this pandemic arrived, we did not, as I mentioned, did not have a lot of detail. Then we were able to get implemented some protocols based on the Department of Health, CDC, and OPWDD mandates. Once they were in, we had a clearer perspective of what we needed to do. We all remember clearly when we sheltered in place and stopped visitations to residences and suspended programs and facilities. That was a very difficult time for us, for our individuals, and for our families. And of course, you know, we sanitized, hand washed, testing and temperature checks became a standard process for us. And we're still doing all this now. At this time, you know, we cannot really forget the lives we lost due to the pandemic. We are deeply saddened that we lost 6 of our residents and 1 staff member. We hope, obviously, that we will never have to repeat that. Hopefully, the measures that we're taking moving forward will help us. We also experienced 32 individuals with presumed confirmed positive cases and 105 staff members that were confirmed positive. We quickly developed day services in residences and remote learning at home. And we were pleased that we were allowed to resume home visits. And I believe that happened in the summer, and an in-person day services reopened in the beginning of the fall. I think it's also really important to reflect on the excellence and the dedication and the resilience of our staff. We wouldn't be able to really have reduced number of positive cases without the support of our direct support professionals, our frontliners, and as we call them, our heroes, and as well as all the people that support our system in the organization. So I just want to make sure I recognize them and show you that the importance of our staff in all this that we've done. Next slide, please. So now I'm going to turn it over to Deb Mondello, who is going to give you a status report on the vaccines and the vaccine strategies that we're looking at right now. Deb?
Yes, good morning. Next slide, please. I'm going to go into a little bit more detail just so we can share with you our COVID numbers for the individuals we supported over the past year. What you're looking at is just a calendar chart from March of 2020 to the present February 2021. Those are the months across the bottom and the number of positive individuals up, going vertically up onto the left. The beginning numbers in March and into April, we also included some presumed positive because at the time we did not have access to testing like we have now. You can clearly see the initial spike in 2020, the flattening of it through the summer. And then again, as we hit the holidays, the Thanksgiving, Christmas, and New Year's, the significant spike again for the second wave. As Tibby mentioned, in 2020, we had the loss of 4 individuals. And in 2021, we had 2 deaths. Next slide, please. Okay, what you're looking at now is the number of positive staff per month, new confirmed COVID cases for 2020, 2021. You know, these are mostly confirmed positives. And again, in the beginning of March and into April, there are some presumed. And again, you can see the same kind of curve. The big spike in April with 42 staff, then a flattening of the curve, and then again through the holiday season, an increase. If you actually add December, January, and February together, it actually equals or surpasses April. So there really was a significant spike after the holiday season, which is why we were also giving a lot of information to families and the houses on having a safe holiday season. Next slide, please. Okay, this is the number of quarantine houses by month. A quarantine house, a house would become quarantine, not just if there was a positive individual, but also based on exposure. So as Tibby mentioned earlier, there was sheltering in place early on. And as we, you know, we kind of made it through the first surge, March and April, again, you know, kind of flattened through the summer. But when we hit the holiday season again, you know, the level of exposures really just exploded. And we really had to take a hard, careful look at what was happening. So the quarantines were in place to prevent the spread. And I just wanted to also add that, of course, we were cohorting staff. We were not letting them go from house to house. You know, we were in full PPE equipment in a quarantine house, which means above masks and gloves, we're using gowns, we're using face shields, we're burning through the PPE equipment at a much higher rate. And, you know, December into January was pretty active. We had thought that 10 was a high number back in April, but we doubled that after the holidays in January. The average quarantine was about 12 days, and that is basically because as testing became more widely available, we were able to test individuals and staff out of quarantine so that we could return to some normalcy with the confidence of having a negative test. Next slide, please. Okay, so let's talk a little bit about the vaccination, and we're going to go through some of our numbers and our journey. And we had some early questions come in that I think I can answer during this part of the presentation. So, of course, vaccine arrived in New York around December 17th or so of 2020. I'm sorry, could you go back one slide, Regina? Thank you. So we were among the first chapters to receive vaccines starting around December 28th. And I'm going to go through our journey shortly. But we really worked hard through Christmas to ensure and secure authorizations, consent forms for the vaccine. We quickly reviewed the criteria. And we really swiftly started making appointments for the people that we support. I just wanted to also add that the ARC Wester is not a distributor of the vaccine. We're not a provider. Next slide, please. Okay. Another tremendous area that we put in place this year was our staff vaccine education. So because many of our staff felt the uncertainty of getting the vaccine, we worked hard to develop a campaign. We did a facts and myths sort of busting sheet on the vaccine. We also trained our managers how to deliver the message and sent them into the houses to do some small group chats with our staff. We also had our director of nursing give a pretty significant presentation in December on the importance of the vaccine. And we highlighted signage through videos, photos, testimonials. And that's a great picture of Del Rey with our director, Exion Edwards at the bottom, and some other staff. And we also did a little, I got the vaccine because of, and they would hold up a sign and they might say, I want to keep people safe. I want to stop the pandemic. So those are some of the staff vaccine education components. Next slide. So we had two questions. When will staff and housemates receive the vaccine, and what is the process for scheduling? So I'm going to go a little bit into more detail of our vaccine journey. Next slide. So currently, in our residences, we have about 190 individuals of about the 235 that have received the first vaccine, and 166 of those have also received the second vaccine. So we're up to about 82% of the individuals in our houses have received the vaccine. We have about 87 residential and 47 staff, day staff that received the vaccine, and about 55 other staff. Unfortunately, despite our education campaign, we continue to have about 171 DSPs and 40 DSPs in daycare that are refusing the vaccine. We continue to work on this area in encouraging, but also we will say that the access to vaccines remains a challenge. Next slide, please. So I'm going to describe a little bit more detail our vaccine journey, because there were also questions on how the vaccine was scheduled and rolled out and how individuals and staff had access. So looking at the top of this slide from left to right, our first resource early on in December was really the hospitals. You know, initially, I think I mentioned that our first vaccinations were given on 12/28. We received some links actually on Christmas Eve, and we immediately sprang into action to register as many of our individuals in the houses that were in the highest priority category. And that first high priority category, just looking back, they were actually the houses where 50% of the individual or greater of the individuals in the house were over age 65. So we had identified about 12 houses, and we immediately started using those hospital links and registering our individuals. Around the time of January 11th, however, I think people have been aware that 1A was the initial group. 1A included frontline workers, congregate care individuals, doctors, nurses. But on 111, 1B was added. And 1B really kind of, sort of slowed down some of our access. The numbers are basically that in 1A, that group eligibility was about 2 million people. In 1B, that group eligibility was about 5 million people. So then suddenly in mid-January, you get about 7 million people competing for the same limited number of vaccines. We did encourage our staff because, again, the priority was the individuals that we support. And while the DSPs that were bringing the individuals to those hospital appointments were eligible for the vaccine, we also encouraged frontline staff to try the links themselves. Our other option around the beginning of January was a long-term care pharmacy. and that's LTC stands for long-term care pharmacy. CVS was our assigned long-term pharmacy. However, CVS was only assigned to about 7 of those 12 identified high priority houses by the CDC. So currently, there are no plans for CVS to extend services to us. Their reliability was sporadic, quite honestly. They did not have 12 houses assigned, they had 7. And by the time they kind of entered the picture in January, which was a little late for us, we had already vaccinated whoever we could that was eligible in the weeks from the 28th of December to, really that second week of January. Our current pharmacy provider, which maybe some of you are aware is Grassy Sprain, they are not permitted to provide vaccinations to 1A. Our third venue, which is what we're working on now, is the local health department. So we've contacted the local health department and the commissioner to push for more access to vaccines. It's been rather stagnant for about the past 2 weeks, going on 3. We were initially given about 100 slots at a clinic in White Plains. We do anticipate more slots, but again, the supply chain has been slow. And of course, the bad weather at the end of mid-February really impacted the vaccine availability. Again, the priority remains the people that we support for the 35 to 40 people that are left. I also wanted to add that those individuals may not have been eligible for the vaccine if they were in a quarantine house. You cannot get the vaccine if you are in quarantine or you have active COVID. Next slide, please. Okay, so I think I have a couple more questions. Our son lives in a ARC residence and has received his COVID vaccines. Without breaking any HIPAA rules, how can I inquire as to whether his housemates and staff have been vaccinated? So I'm going to answer that one first. I can't tell you who has or has not been vaccinated. I can tell you that our current rate is about 82% and that we still have more individuals that we expect to be vaccinated. The refusal rate for the vaccine is very low. So we expect it to land somewhere around 96 or 97% vaccinated for the residential individuals as a whole. Next question on here is, we have not engaged in community activities with our son to help protect residents and staff, but now with the availability of the vaccine, we would like him to be able to resume activities. So I think I want to say just thank you first off to this family for their conscientiousness in helping us protect individuals in their homes. Throughout the pandemic, we have provided guidelines for visitation, travel, and outings. So there's not, I'm going to say there's not specific restrictions that people can't go. However, we continue to review the CDC, the DOH, and the OPWD guidelines, and we're adjusting these guidelines accordingly. I will, just reiterate that temperature taking, social distancing, and mask wearing is still required. Next slide. Okay, so we got a question here. How can we register for the vaccine? So I'm going to jump right in with where there's potential vaccine availability. Next slide. Okay, so just to reiterate, we are not allowed to administer the vaccine. We are not a provider. It has been extremely difficult getting the COVID-19 vaccine in Westchester. As I mentioned, once the vaccine was open to 1B, the access has been limited. However, the 2 current areas right now, WIHD is identified as a vaccine location. You can go to their website. They have very, very small numbers available. They're actually a subset, we've learned, of the White Plains Clinic Center. So I think Tibby and I saw this week that the White Plains got 2,700 vaccines, which is not a lot for a week in Westchester. WIHD got a small portion of that. They're also prioritizing current clients because we've been in touch. The best way really is to go to the New York State website, Am I Eligible? And keep trying to schedule an appointment. People are getting lucky just hitting the refresh on the links over and over, because this will provide you with the different locations. It could be the county center in White Plains. It could be the White Plains Clinic. It could be some hospital sites. and really just due diligence of continuing to hit the links. Registering one person or individual at a time is easier than getting a group. This is what we continue to look for. But again, we are really pushing with the local health department to secure a larger grouping of slots for the people that we have left in the houses and also our staff. Next slide. If you are able to get an appointment, there are basically 4 steps, and I just put them up here. They're directly on the website that we provided. But the first step is to determine your eligibility and to schedule the appointment. You get a confirmation email with a barcode, and you bring that barcode with you. You complete a vaccine form. It's online. If you're not able to fill it online, it's also available at the vaccination site. You have to bring proof of eligibility to your appointment. That could be identification on your age or anything else that identifies your eligibility. You may also be asked for insurance, but the vaccine is free and you won't be charged. At your first dosing, you will receive an appointment card that'll tell you when to come back again. So you'll be immediately scheduled. And when Eileen talks a little bit more about the vaccines, Pfizer and Moderna are 2-dose, and the Johnson & Johnson is only 1 dose, and the days are different on those as well. Next slide. Okay. So when will vaccinated parents be able to visit with their vaccinated children at the supported apartments without staff present and without pickup and drop off of temperatures taken? This may give a short staff location, more time to do the work, and parents more flexibility. So at this time, temperature checks are still required, and I do expect them to be required for a while, as well as the mask wearing and some of the social distancing. So we understand that this may be inconvenient. The vaccine is highly crucial to our recovery. It is, it's 95% effective, which is great, but there's still a chance that, people could be sick or have a fever. So we're still taking temperatures. Next slide. And I think I'm going to let Tibby answer that question. How will things change now that many group home residents have been vaccinated?
Thank you, Deb. I appreciate your presentation, and I think it is, this is a great question. We are asking the same question to our regulators, OPWD, DOH, CDC. And we all know that the news is now getting filled with these new relaxed guidelines. But unfortunately, that doesn't affect us yet. As Deb mentioned earlier, we will be reviewing CDC, OPWD, and DOH guidance and adjust guidance accordingly as soon as we hear any opportunity to relax. We are all for obviously adjusting and making changes, but again, we have to remind our families that it's really not up to us, it's up to our regulators. And of course, this time it's very important that we continue to do our safety measures, wearing masks, washing hands, and sanitizing. So that's all going to continue. At this time, I would like to introduce our next speaker, Eileen Hughes, our Director of Nursing. Eileen?
Thank you, Tibby. Hi, everyone. I'm just going to give a short presentation on what you need to know about the vaccine. So an overview. The vaccine basically teaches your immune system to recognize and to attack the virus should you be exposed and get the virus. The vaccines are not made from a live virus. It's a fractured virus, and it cannot give you COVID-19. The side effects are like a fever or muscle soreness, are an indication that your immune system is working. So don't be worried if you get the sore arm, or you might get a little fatigue, headache. There have been a few cases where, a little bit more concerning side effects, but basically the normal side effects and the amount of them is nothing more than a mild flu. But on average, most people get a sore arm or nothing. If you have had the virus, you still will benefit from getting the vaccine. One is an active immunity and one is a passive immunity. It will help you. And studies show that even if you get COVID-19 vaccine and do get the virus, it will not be a life-threatening case. So the severe ICU cases and the severe hospitalizations should not be the case any further after full vaccination and immunity is in place. The vaccine is saving lives and hospitalizations. The goal is for everyone to be vaccinated when larger amounts become available. And if given the opportunity, I'm asking for everyone to please take that vaccine when it's available to you. Don't wait for a specific vaccine. I'll tell you a little bit more about that on the next slide. The vaccine is covered by medical insurance at no cost to you. It's out of taxpayer dollars that this has been paid. You will bring your insurance card and could be charged for the person giving it to you. It is minimal, but if you do not have insurances, you will not be charged anything. Next slide, please. Okay, so I'm going to talk about the difference in the vaccines a little bit here. So initially we have Pfizer and Moderna vaccines. The first COVID vaccines authorized for emergency authorization came in December, and that was the Pfizer and Moderna. After many, many months of clinical trials, both these vaccines were manufactured in the United States as well as in Europe. So both these two vaccines are a 2-dose immunization system. One injection day one, followed by a second injection. The Pfizer vaccine is 21 days apart, and the Moderna is 26 days later. Second dose is reserved for you at the time of your visit. And these two vaccines do require the deep freeze storage. Now, February 26th, the 1-dose vaccine, Johnson & Johnson, is out and was approved for distribution. And this is currently being distributed in more rural areas of our state, although we may be getting it in this area soon if it's not already here. It does not require deep freeze or refrigeration. So on this vaccine, the Pfizer and Moderna, you'll hear different things, but they are mRNA vaccines. That means it makes a mirror image in a certain portion of your cell, of your RNA. Okay, so it does not go into the core of your cell, and that's where people are worried. It stays on the outside of your cell, and so there is no DNA changes that are happening in your body. It is in place, and it because of its replication, if you do come in contact with the virus, it has what it's need in your body called an antigen, where you will be, if you have the vaccine, it comes in. The virus would enter your body if you were exposed, and you will have something in your body to be able to have an immune response, so you do not get the severe cases of the COVID. Johnson & Johnson, on the other hand, is what they call a vector vaccine. And the vector vaccine being one shot, which is really wonderful, and only needing regular refrigeration. This vector vaccine produces something in the body like the proteins, those red, you've seen the picture of COVID, the red spikes on the outside of the COVID. And it will send out a response as soon as you are in contact or exposed to COVID to protect you, and it initiates the immune response. So the side effect with Johnson & Johnson is much less overall through clinical trials. And they're saying the side effect with Johnson & Johnson is simply a sore arm for a few days. The other thing about Johnson & Johnson, the president has reached out to Merck Pharmaceutical with Johnson & Johnson, and it's also being produced at with Merck Pharmaceutical, so that many, many doses more can be made, and we should have enough vaccine in this country to vaccinate everyone in the United States by the end of May. Next slide, please. Okay, at this time, at this time, I want to talk a little bit about the eligibility. So plans were implemented in New York for fair and ethical distribution of the vaccine. And phase 1 and phase 2, 1B, 1A, large groups, including the first responders, nursing home, people over 65. This is what we have been dealing with for several months now: medical and hospital staff, restaurant workers, first line responders, grocery store, individuals in our certified residences and their staff, and more. So on February 15th, people with comorbidities were added, and with developmental disabilities living at home became eligible. The proof that is needed for this eligibility is ID. When I went for my vaccine, they ask for a picture ID if you have it, or a New York State or some kind of an ID, a passport, a birth certificate. And they're going to ask you to have your insurance card. So if you don't have insurance, that's okay. But that's the two things they will ask for, along with your appointment barcode that Deb previously spoke about. So next slide, please. Okay, so for safety for COVID-19, even after you receive the vaccine, we have to continue all healthcare and safety measures. We need to continue with the 6 feet distancing from others and wear a mask correctly over your mouth and nose. The thing that most recently came out from the CDC is when you're wearing a mask, please make sure it is a snug fit on the side and under the chin and at the bridge of the nose on all sides, snug fit. And you can accomplish that by a simple twist of the band that is going around your ears before you place it over your ear. So they have found that if you are in a crowd or wearing a mask correctly, if you put a second small mask over, a disposable mask, that they're stating that if you have that second mask over and you're in a crowded environment, you're more than 90% protected from the COVID. But please make sure you're wearing correctly. Don't touch the front of your mask. Your hands have been touching things, and that contaminates the front of your mask where you're breathing through. Also, wash your hands often. Use hand sanitizer if unable to wash with soap and water. And wear disposable gloves at gas pumps. CDC and Department of Health have found restaurants dining out and wearing disposable gloves at gas pumps. The wearing of the gloves at the gas pump, everybody comes out of their car and just pumps gas and gets back in the car. Then they're touching their door handle, the steering wheel, and whatever else. So make sure you are gloving up when you're going to pump gas, and hand sanitizing when you take those gloves off when you first get in the car before you touch anything. And then dining out is the next thing. Just being very careful and mindful when dining out. Continue to disinfect all the touch points in your home. That's things that you frequently touched: doorknobs, handle for stove, refrigerator, ovens, faucets. Continue to disinfect them, and be aware of all travel restrictions and reduce travel if possible, and avoid unnecessary exposures. But most of all, get vaccinated. It is the biggest thing we have right now to protect ourselves, our families, our loved ones, our individuals. So please get vaccinated. And at this time, I'd like to welcome back Tibby, who's going to continue the presentation. Thank you.
I'm actually going to jump in and answer a question that popped up before we go into the budget. There was a question in the chat. If there are pop-up vaccine sites, can the House schedule their own vaccine, or can Westchester do it centrally? We're actually doing both currently. So centrally, we're checking daily with White Plains, with WIHD, looking for any appointment availability. And as we find links, we're also circulating them to the houses to further register individuals. So we're doing both. And Tibby?
Thank you, Deb, for answering that question. Again, please feel free to type in your questions in the chat box, and if we have time at the end of this presentation, we'll be happy to answer your questions. Okay, as I mentioned earlier, this is the time of year where the executive budget is presented, and it released for 2021 and 2022. As you know, the fiscal year of the state starts April 1st. I will be presenting how the budget will affect us unless our legislators reject the proposed cuts. Next slide, please. As you can, you're aware that the governor's budget has targeted a 1% Medicaid cut by New York State. And this is a statewide impact of 60 million for the developmental disability sector. This was a surprise to us, actually, I want to add. The next item we were aware of last year. And now they have delayed this particular cut to May 1st. This is an OPWD specific cut, where they propose for changes in the reimbursement for IRA, which is the residential services that we provide, and ICFs also. These are the the acronyms for all our residences. And it's concerning because they're going to eliminate the occupancy adjustment result from vacancies. What does that mean? This is the cushion that we get when individuals are in the hospital or they're at home visiting their families. There is a gap there where we can't bill. And this also affects the vacancy piece, where we have a gap in vacancies. We're waiting to admit somebody to a new home. And, it's a process where people have to be evaluated and make sure that we have a person-centered approach. That takes time before the individual is actually starting their life in one of our homes. So this is very, very important to us, and that they're going to take all that away. They're also going to slash the reimbursement by 50% for retainer days, which is when residents are in the hospital or are taking a therapeutic leave. This is again a term is used when families want their loved ones to come to their home and visit for whether it's a day or a vacation. And of course, it's not enough just to end there. They're going to impose an annual cap of 96 days of therapeutic leave days. That means that the maximum amount of days someone can visit their family is 96, and after which reimbursement will be reduced to 0. And then missing from the budget, which we think is very important, and we talk about it on a yearly basis, is the 1% statutory cost of living adjustment that has continued for more than a decade. And this is very concerning because this is what we used to have to help give our staff annual raises that they no longer have had since this deferment. And it's very concerning that they continue with that process. So also the governor has indicated that if he receives $15 billion in federal aid, he would restore the cuts. But that was only a comment. We would like a statutory guarantee of that comment. So it's important that we inform our legislators of that. So at this time, I'd like to take the next question. Next slide, please. Okay. In this question here, a family member asking, how would the planned cuts in New York State funding affect Medicaid, Medicare, and Social Security? These specific funding cuts affect Medicaid only. For a person living in our home, it affects their residential environment and day programs. For a person living with their family, it affects their day programs. It does not affect Medicare and their Social Security benefits. That is a federally funded, but also federally monitored. Medicaid is delegated to the states to manage. That's why Medicaid is different. This can be very confusing. And also, who can parents contact about this in New York State Legislator? This is a very good question because this is exactly the questions that we want families to ask. And I'm going to answer that by the next slide, with the next slide. In this slide here, the best way is to contact your legislator. And how do you contact your legislator is to first find out who is your legislator. And we provide that opportunity to find that out through our website. So if you go to our website at arcwestchester.org, you can find your representative by clicking on the advocacy banner. This is key. And we also have facilitated the process to connect to your legislator and talk about the issues that we are concerned this year. For instance, the rejection of the $60 million that I mentioned before, the ask to restore the deferment of the COLA that we also mentioned, and of course, to support us to enhance pandemic pay for DSPs. We have not received any relief at the state level for the last year's cost and pay that we had to disperse the DSPs and all the work that they've done. We have not received any relief. And of course, I mentioned the statutory guarantee for to eliminate the cuts should they receive the $15 billion in federal aid. So this is extremely important. So just several clicks and you'll be able to submit your letter. I do it all the time, and you get an instant reply from the governor, and you also get a reply from your state legislator. So this is a great, easy way to show your concern over the cuts. Next slide, please. So here, again, we talked about Developmental Disability Awareness Month, how important it is. And we can't say enough. Your advocacy is key to help us in our future survival. Your advocacy is what's going to help us reverse these cuts. Your advocacy is going to help us increase the innovation of the programs for our organization. And your advocacy is going to really support our staff who need the additional support in order for them to their salaries to be increased. So please write your legislators and tell personal stories. That's also very impactful, and how it will affect your family member. Again, we are aware that March is an Awareness and Inclusion Month, and this is really also, you could mention that to your legislator. And we want to make sure that we showcase our achievements and showcase our talent of our individuals, and we work everything that we do every day to improve the lives of the people we support. So please go to our website at www.arcwestchester.org and take action. This really ends our presentation, so we are happy to answer any additional questions. I'm going to look at my phone to see if there are any questions. And we seem to have one question here. According to, they're asking, attendee is asking you, asking me to confirm date on the budget slides. Question. I'm guessing this is specific to the May 1st changes. Yes, my understanding, OPLWD has indicated that May 1st, 2021 is when the cuts to residential services will begin. I'm hoping I answered the question correctly. So if there are any other questions, that we are happy to answer them at this time. Christina, do you, no further questions? Okay, thank you, Christina. Again, I want to thank everyone for joining us this morning. It's 10:50. We're happy to answer any questions later on if you think of them. Please email us your additional questions to info@arcwestchester.org, and we can certainly try to answer any questions that we can. This is a time of some confusion again in reference to vaccinations and so forth, but we're going to make sure that we inform all our families should more locations open up, regarding vaccines. Thank you again. Thank you for joining us, and enjoy the rest of your day.
Okay, everyone, I think we're all set.
Oh, okay.